Dr. Jared Reading again with the Uvalde Health Authority. This video is more for employers. Employees can use this as well. We're getting a lot of people showing up to the doctor's offices and to the hospitals saying that they need a retest, that their work won't let them go back to work without a retest showing them they're negative. No, we've learned a lot about the virus now, and we know that you don't need to retest. We know that if you have mild to moderate disease that didn't require you to go to the hospital, that you're not contagious after 10 days. They've done the studies on this. Now you can test positive for virus. We've had people here in Uvalde test positive for virus back in the beginning for a good 10 weeks. And there's been documented longer than that, throughout the world. But we know that if it was mild to moderate disease and you did not need to go to the hospital with your COVID diagnosis, you do not have to retest. You are not considered contagious despite positive testing. We know this by laboratory data, and we know this by contact tracing as well. So they've done some really good studies for contact tracing. They haven't been able to find anybody who had mild to moderate disease pass it along after day 6. And then the laboratory data is showing that they can't grow live virus or virus which can replicate itself after day 10. So we're using day 10 to be on the safe side to make sure that we're extra safe, but we know that after 10 days, you're not contagious. I get employers calling me saying, well, how do I protect my business? What I would recommend is that you download the CDC's recommendations to end isolation and you keep them in part of your HR department. That will protect you. You can say, listen, I let somebody come back to work and I followed these recommendations, these guidelines, the best science that we have regarding this virus, and they came back to work. We didn't retest them because we didn't have to. We didn't retest them because we know they weren't contagious, and you let them go back to work. So again, we know you can test positive for a long time, but we know it's dead virus or virus that can't replicate, and that you're not going to be spreading it after day 10 of your symptom onset. Let's say you have an employee test positive who didn't have symptoms. What do you do then? Well, 10 days after the positive test will work as well. So 10 days after the positive test or 10 days from symptom onset, and your employee will not be contagious. You can let them come back to work. You do not have to have them retest. In fact, the CDC and the State Department of Health actively say don't do that because we know that they're going to test positive. You're keeping people out of work longer than they have to be. They might have some mild symptoms remaining. They might have a little bit of cough, a little bit of chest pain left over, not chest pain, a little bit of cough left over, a little bit of weakness. But again, we know that that's just their body recovering, that they are still not contagious. For those people who actually had to go to the hospital, were admitted to the hospital, we're using 20 days. Those people, we know that they started trying to test for live virus, and after day 15, 95% of them, you couldn't grow live virus. So we're using 20 days to be extra careful. Again, it also goes back to 20 days from symptom onset, assuming that they're getting better, and assuming that they haven't had a fever in the prior 24 hours, you're good to go. So the way to protect your business is to use the end isolation criteria by the CDC. You can then use that to let your employees come back. You don't have to retest. Please don't retest. And you don't even have to request a letter from a doctor saying you're good to go to come back. That's just a waste of resources, and our doctors are pretty dang busy right now. So please don't keep sending employees back to retesting. It's not necessary. We know this. If you have any questions, feel free to email me or to contact the hospital, and they'll get a hold of me there. Thank you.